Good morning, doctors. Welcome again. Today we are going to discuss here about INI-CET Pharmacology Memory-Based Paper 2021. Not an off-label use of risperidone is risperidone used in OCD, in bipolar disorder, in dementia, but in post-traumatic stress disorder, FDA not approved risperidone. Risperidone is atypical antipsychotic drug. Patient on retigabine for epilepsy add phenytoin. Next step is with retigabine, if we add phenytoin, then it decreases the effect of retigabine. So best here to increase the dose of this. So answer is increased dose. Combination therapy not useful in combination therapy. For gonorrhea we use like ceftriaxone, doxycycline, etc. 2 drug. In TB single drug is not useful, so we have to give combination therapy. In malaria also we use combination therapy, but in intra-abdominal infection we use single drug. So this is answer here. Now, patient with HIV and tuberculosis infection, co-infection, what should we do first? Guys, in HIV with tuberculosis we have to give anti-tubercular treatment first, then ART after 2 weeks. So always start with anti-tubercular drug first. If you start ART, then infection chances is very high, so always start ATT. Now, patient given prophylaxis with clopidogrel for stroke. He present with a stroke again. The reason is inhibition of enzyme CYP2C19. This enzyme is inhibited, that's why there is a re-stroke chances. Now, elderly lady for metastatic breast cancer, she had pancytopenia. Now she presents with fever with antimicrobial, cannot be used empirically in this patient. So cefepime we can use, piperacillin, tazobactam and meropenem we can use, but linezolid we are not going to use. Why? Because linezolid side effect is bone marrow suppression. Bone marrow suppression and pancytopenia is a similar condition when there is decreased hemoglobin, decreased WBC, decreased platelets. So this is considered as pancytopenia. So linezolid is one of the drug which causes pancytopenia. Now, what happens when double the dose of drug first order kinetic? If you double the dose, half-life is always same in first order kinetic, but plasma concentration is double. So answer is A. Not priority among these for essential medicine list. For essential medicine list, we have give priority to cost benefit ratio, and large clinical safety is required. Prevalence of the disease is required. For example, some diseases, for example, we can say snake bite or scorpion bite, more common in India. So they are going to make antidotes for that in India. So it's very much necessary, but in other countries like Canada, if there is scorpion bite is very less, so they are not going to produce such drugs. So cost benefit ratio necessary, large clinical safety necessary, prevalence of the disease necessary. So FDC combination is not required for single drug. So this is the answer. Now, drug not used in PCOS, polycystic ovarian syndrome. Clomiphene we can use for induction of ovulation. OCPs we can use. Metformin we are going to use in PCOS, but tamoxifen is not useful. Tamoxifen used in breast carcinoma, premenopausal or postmenopausal breast carcinoma. Okay, thiazide diuretics used in renal failure. The safest diuretic is metolazone and indapamide, but if we choose single best answer, so metolazone is the best answer here. Okay. Topiramate used in treatment of, topiramate is used in both migraine and LGS, but the best option here is migraine. If you want to choose single one, then migraine is the best answer. Drug used for long-term management of obesity: sibutramine, fenfluramine, metformin, and liraglutide. Liraglutide is approval drug for long-term use in obesity also, and this drug is useful in diabetes, in reduction of obesity, and this is best drug GLP-1 agonist. Inhaled nitrous oxide used treatment of, this is mainly useful in treatment of pulmonary hypertension we are going to use. Okay, now mechanism of paradoxical bronchoconstriction in ipratropium is due to, so benzyl conium chloride, prejudicative M2 receptor stimulation, use of hypertonic saline due to irritation action of drug. So guys, this MCQ answer write in a comment box. This is a task, and thank you for watching this video. If you like my videos, put like on it. Thank you. Good day. Goodbye. That's all for today.